Hi there, Hi there, Julian Bollitter from Audric here. So this is not so much a lecture, just quick, a quick summation of a recent paper we published on the potential urban planning implications of pandemics in Australia in particular. There's no images, it's just me talking, and basically just recounting some of the findings we've written up in a recent journal paper, which is still to be published, which emerged out of a survey we did. We're currently conducting the second stage of now, but the first stage we did earlier this year. It's called Plan My Australia. So it was a survey that went out to, was done by about 290 experts from around Australia, planning experts, who were basically looking at different scenarios for how we could distribute a doubling of Australia's population by 2100, which is what the Australian Bureau of Statistics is estimating. Just opportunistically, we chucked in a few questions around the pandemic and what planners might envisage could be the implications of pandemics like the one we're in the midst of right now. So this paper and what I'll talk about today is not really a part of the general survey that we conducted, but it was just a relation to this one specific question of how do you think pandemics could affect urban planning, and what the implications more broadly will be for cities. So I'll take you for a quick run through it, just as I speak. So I guess it's worth just pointing out that this is not the first pandemic that we've ever had, and most of you will know the Spanish flu was a huge influenza pandemic, which kicked off in 1918, and it killed up to 100 million people worldwide. There's a few waves, and it's certainly urban density is linked in quite a number of papers with deaths in relation to the Spanish flu. And of course, we know of the plague of the 14th century, which claimed 60% of the European population. So the Spanish flu wasn't the first one either. They've been going on for some time. But what is happening is there's increasing occurrence of epidemics, which are kind of disease which spread amongst large populations and communities, rather than over multiple countries. But epidemics, which are kind of like a smaller scale pandemic, are becoming common occurrences. And according to reliable sources, they're saying every country on Earth has experienced at least one pandemic since the year 2000. So they're starting to strike with increasing regularity. And some of them are having devastating impacts like the Ebola fever or the yellow fever, which have been prominent in Africa. The World Health Organization contended with 1,483 epidemics between just 2011 and 2018. And these are potentially fast spreading outbreaks, which are increasingly difficult to manage and can morph into being pandemics that we're seeing with this particular pandemic we're in the midst of now. So most countries, and certainly Australia, and Australian states have planning for pandemics and epidemics in relation to how they will deal with them in terms of being prepared for it. However, most of these policy documents are more about, I guess, monitoring social distancing and how you manage the pandemic. They don't really zoom out to the point where they're considering city planning issues. Because it's pretty hard to design cities around pandemics because there's so many different factors operating on cities. They're economic, they relate to people's preferences, they relate to how you service it with service infrastructure or transport infrastructure. So there's all these really pressing kind of forces which shape our cities. And pandemics are not everyday occurrences. And so it's natural that they have kind of slipped from the foremost of planners' minds in thinking about how you make cities resilient to future conditions. So on one hand, we have this situation where the official pandemic plans don't really talk about city planning, but at the same time, the city plans don't talk about communicable disease, which is like influenza kind of pandemics or epidemics or flus, basically. So there's been a lot of work in health and public health in the last decades, which has been looking at how we can design cities so they're more walkable, so there's better active transport like walking and cycling, and that lowers cardiovascular disease and non-communicable disease. Is the effects of that and the prevalence of are lowered hypothetically through better density, connecting everything with active transport and getting people on public transport. And this has been the kind of mantra that has underpinned the planning documents, which dictate the forms of our capital cities in particular. So what we did was to really consider and to I guess question these 290 experts about, well, if you did consider communicable disease, what would the implications be for how we're currently planning cities? Which is a kind of fascinating inversion, because really the focus has been on the inverse, which has been on non-communicable disease. So the findings of the survey were typically threefold. They're related to kind of regional scale suggestions, city scale suggestions, and site scale suggestions. So some of these will relate more or less to the kind of work you're doing. So in terms of the kind of really big scale, regional scale or even national scale, there was a lot of talk about the brittleness of supply chains, which is that we're realising with the pandemic. How brittle and vulnerable global supply chains can be when they're stretched across the globe, when all of a sudden countries are going into lockdown, and we can't, in some cases, can't get the things you need to fuel an economy. Hasn't been too bad in Australia because, for instance, Australia feeds more people than currently occupied, so there hasn't been anything major in the way of food shortages. But for some of the countries, that has been a bigger issue. But there was definitely a refocus on self-sufficiency at the regional scale and at the city scale. Interesting, a lot of people in the survey indicated that they would be much more inclined to live regionally subsequent to the pandemic. This is in the stage 2 of the Plan Maestro survey, which is of just general community. So there's a kind of, there seems to be a bit of a we're on a bit of a tipping point towards people starting to consider moving away from the larger capital cities, these kind of global cities, in the case of Sydney and Melbourne, to more regional cities which are more self-sufficient, which are more enmeshed within nature, which are somehow more disconnected from the global economy, and which can be shut down in a sense, in a way that's easier than shutting down a global city like Sydney, city of 5 million people. So seems to be a growing appreciation that there might be some virtue in thinking about really starting to develop regional cities, which are smaller cities, large enough to have a functioning economy, but not so large that they become unmanageable and they sort of lose their self-sufficiency because their hinterlands necessarily get so expanded. So the idea of these smaller cities, which are very much enmeshed within the landscape and much more resilient and self-sufficient. This was definitely, this came through in both the expert survey and the community survey. At the kind of, if we zoom into the sort of city scale, for the last 20 years, state governments have been attempting to do transit-orientated development, such as development around mass transit, around train stations or rapid bus transit or along urban corridors. The idea being that people will be nearer to a train, they'll be able to get the train to work, they won't need cars, you won't need so much parking space, people will be able to live at a higher density, will reduce carbon footprints, and people will walk more and be healthier. Well, the survey indicated that a lot of our respondents felt that, in fact, while that might have made sense in terms of non-communicable disease, in terms of communicable disease, you couldn't really design a worse urban petri dish, which is, people living at a higher density, people getting around on mass transit, both of which are problematic when you're dealing with a communicable disease, such as COVID-19. So there was a real sense that we might have concentrated to our detriment on density and mass transit as kind of being the silver bullets that would fix the sustainability and health-related issues of our sprawling cities. So there was a sense there that we need to be designing our cities so that we have really good active transport. So there's a refocus on not so much mass transit, but alternative forms of private transport other than the car. So, old technology like cycling, but also emerging technology like electric scooters, electric skateboards, electric bikes, going along kind of systems of active transport networks and pathways, which are ideally sort of threaded through linear parks in nature. So there was a sense that there could be a much finer filigree of transport infrastructure threading through our suburbs, rather than this idea that everyone must live in this big kind of this big concentration of people around mass transit. It's about much more of a diversity of finer transport systems and ways of getting around. The COVID-19 has seen a massive uptake in the use of public space, and the kind of there appears to be some kind of this informal kind of urge to connect with nature, which has been going on to varying degrees. But that has been something which has been noted across most Australian cities. It's been an increase in the use of open space. So a lot of our respondents, particularly, were focusing on how we can weave nature back into the city. Even in some cases, how we can start to look at creatively repurposing golf courses and things which might be privatised and turning them towards public space, but designing them in a way which people can social distance while they use public open space. So the way walking paths might need to become wider, the way play equipment, for instance, is more dispersed. How all this works exactly is unknown, but definitely the importance of public open space was noted. At the city scale, so at the city scale, we had questioning of density, questioning of mass transit, greater attention to be paid to different forms of alternative personal mobility and active transport, a refocus on public open space and how it could be used during a lockdown situation, or sorry, in a kind of where we're self-isolating situation. The other dimension of it was the theme of self-sufficiency really expressed itself again at the neighbourhood scale. So the idea of people growing a lot more food and I guess some of those ideas we talked about in terms of smaller regional cities being self-sufficient, that same idea working at the kind of city or even neighbourhood scale. How that would work exactly, it's not that clear, but I understood it to be people growing more food and having the kind of all your major needs met within a kind of walkable catchment, which isn't really that different to what planning currently tries to achieve through livable neighbourhoods, for instance, in Perth. So they were that was the major thinking around the city scale. As it applies to the site scale, there are a lot of suggestions about how we can make particularly high density dwellings and buildings livable during a lockdown situation. What came through the surveys, the Plan by Australia expert survey and community survey, was a real reappreciation of the Australian suburban dream. And for those who have been able to reside in a suburban house during a lockdown, it certainly apparently offers much in the way of amenity. In a lockdown, you can grow food, you can sit in the sun, you can open the place up with ventilation. The kids can run around in the garden without going too mental. Likewise with the dogs. And in a way, the lockdown, for some suburban dwellers, I think was pretty idyllic. Compare that to living in a studio apartment in Parramatta, Western Sydney, where you're probably relying on the city's cafes and restaurants and bars to be your living room. And the parks are your garden. And all of a sudden, when those things in a lockdown situation potentially are not accessible anymore, you're suddenly stuck in the studio apartment, really without this connection to nature, which has come through as being such an important theme in a lot of the responses we've received. So I think there was a sense in the responses that we should be trying to offer at a higher density a lot of those kind of virtues of the suburban lockdown. So things like, rather than having communal gardens around apartments, trying to privatise them so that you have your own private green space you can access in a lockdown situation. Trying to kind of alleviate the sort of densities by which you can't have some access to the ground and you can't grow food and ensconce yourself in nature and actually get some release, from what might be quite a small apartment environment. So there was definitely a questioning of that kind of density. There was a questioning of how you actually design buildings in terms of communal spaces. We talked about communal outdoor space and how that might be more privatised into private gardens, but it's also about indoor communal space. Really, the nerve centre of any building is the lifts, And that's where so much of the transmission is occurring around communal lifts and communal stairways and hallways. So what you might be doing is starting to design buildings where there's a limited number of apartments which are appended to any one entry or exit. The idea being you can, leave your apartment and access the street via a shared door that you might only be sharing with 3 or 4 other apartments, as opposed to 30 or 40 other apartments. So really looking at the communal space and how that can lead to transmission if people are not super careful, which over the longer term then often not. And I think this is what we're finding now is with Melbourne going into the second lockdown situation and these sort of statistics around there being much less discipline being applied in this second lockdown than there was in the first. And part of that, I think, is because you can only maintain the rage so long. And particularly if you are in a high density setting where to maintain the lockdown, you're really having to undergo real deprivation in terms of your lived environment and lived experience. So what's important is that we need to be designing high density dwellings in a way that when you do need to lock down, that people really can do it in a way which is sustainable. So that when you do have a second wave, such as is occurring in Victoria, people are able to go back into that second lockdown with more discipline because their environment allows it. So there's some of the kind of things which talked about at the building scale. There was also a lot of discussion around flexibility and how we plan different spaces. There's a lot of discussion that we're going to need to design, train stations quite differently. So there is a lot of room so people can social distance in that train station environment. The same with airports if we ever do reopen them. And finally, how we locate hospitals. What we're finding, particularly in America with the pandemic, has been hospitals being completely overwhelmed by the number of cases they're dealing with, and actually trying to locate and co-locate hospitals with open space. So you have room for hospitals to really expand when and as they need to, as you have large waves of people checking into the hospital for coronavirus symptoms or whatever. So the idea of actually building flexibility into how we plan for hospital environments, but also train stations, also other mass transit kind of hubs, so that we can manage social distancing in a pandemic. So there were just some really broad kind of reflections which came out of the survey. Certainly when the paper gets published, it's something we'd like to share. I think finally to just conclude with, we're very much still in the midst of this pandemic and we don't really know how this will all end. And I realise anyone who at this point in the midst of a pandemic claims to have all the answers is likely to end up with serious egg on their face. It should be said that a lot of the planners we had in our survey actually didn't think it should really affect city planning going forward. And that it wasn't really a major driver of urban morphology, urban change. Anyway, a number did. It's really hard to know which way that will go. I think it will have some effect. But it's really important that we don't react in a kind of knee-jerk response to the pandemic, which is to say then that everyone should just drive anywhere and that, well, if you're going to be commuting to work by the national broadband network, then why not live, why don't we just irrigate a whole new wave of suburban sprawl? I think would overlook the fact that there's plenty of other reasons why we probably do want to do density, why we do want to do density within reasonable proximity, the city centre and its knowledge economy jobs, why we want to do it in high amenity settings and in relation to some mass transit. So I think it's really important we don't throw out the baby with the bathwater in this case by overreacting, which would be hard to do anyway because cities have such path dependency to them. They're like turning an aircraft carrier. So the idea that you would suddenly turn it at 90 degrees because of the pandemic is unrealistic anyway. But these are just some reflections which should, in time, I think, once the full picture is known, find some expression in the kind of planning for our capital cities. Currently, none of the plans for our capital cities mention anything around communicable disease, at least as I could find it, and none of the pandemic planning refers to anything in relation to city planning. I think what the survey shows is there are coincidences there between the two, which are worthy of further exploration. So this paper and this presentation is just very much some initial reflections, and perhaps will stimulate some other thinking and more work in this area, which I'm sure will be presuming occurring at a pace around the world. Okay, thanks for listening.